Hi everyone, Dinesh Sirisena here, and today we're going to be talking about imaging a Morton's neuroma of the foot. When undertaking the imaging, I'd suggest having the patient lying in a supine position with the foot resting or maybe even hanging off the end of the bed. This should be much more comfortable for the patient, and hopefully for you, when undertaking the imaging, it should make it a little bit easier to manipulate the foot and identify where the Morton's neuroma is situated. So remember, a Morton's neuroma typically sits between the third and fourth or the fourth and fifth digits. When undertaking the imaging, I usually use a linear transducer with the capability of reducing the frequency to improve the penetration, particularly if you're looking at the foot from the plantar aspect, which has slightly thicker skin. You can start in the short axis orientation to identify the metatarsal heads, and then change it to a long axis orientation to further interrogate the web spaces individually. When undertaking the imaging, it's useful to squeeze together the metatarsal heads, first of all to see if you identify Mulder's clip, and secondly, to identify whether there is this hypoechoic swelling that pops out from between the metatarsal heads. And this is what you're hoping to see on the ultrasound. So in the short axis orientation, you should see the metatarsal heads, and you may see a hypoechoic swelling between them. And then when you're further interrogating the web space, you want to see the soft tissue of the web space with no bones in that field of view, and you may see a hypoechoic change which is representative of the Morton's neuroma. In both situations, you can palpate from the dorsal aspect of the foot to see whether this hypoechoic change is a firm swelling or whether it is compressible. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter, Instagram and TikTok, and remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.